Hello, my name is Allison Duffy, and I'm here today with Elwyn Clark and Asia Burks to give you a little presentation about how to become vaccinated in Hamilton County. It is important to see the effects of the coronavirus within your community. Because of this, I've compiled a couple of facts just to show you how the coronavirus is affecting your minority community. Did you know African Americans account for 25% of those who have tested positive for COVID-19 and 39% of the COVID-19 related deaths, while making up just 15% of the general population? Also, people of Hispanic origin are 2.3 times more likely to die from a COVID diagnosis than those that are white and non-Hispanic. By now, most everybody in our community has heard about the COVID-19, or also known as coronavirus. Just to give you a little background about this disease, there are several factors which it can cause. It can cause severe illness with flu-like symptoms and can result in death. It affects the elderly and those with weak immune systems most often. It is transmitted from close contact with other people who have the virus and is very difficult to prevent. But here are some ways to prevent the coronavirus. You can wear a mask while you're out in public, and make sure you want to wear this mask properly. See down in the left-hand corner, this individual is wearing a facial mask that covers both his mouth and his nose. In the next image, it shows a general hand washing technique. While hand washing, you'll want to cover all surface area of your hands and wash for at least 2 minutes. The next image shows how you'll want to practice social distancing. And this may be one of the most important factors. While social distancing, you'll want to stay at least 6 feet apart and remember to wear your facial mask at all times. Next, what we're going to cover in general is becoming vaccinated. It has come to our understanding that there are a lot of misconceptions in minority communities, and that is why we are here today to help clear some of those miscommunications. To start, let's give just a general explanation of the COVID-19 vaccination and why it is important to get. Some basic information about the vaccination is that it produces immunity to the virus. It protects those most vulnerable to the virus by creating herd immunity. It decreases the infection rates in all communities, and it also decreases the potential of death due to the coronavirus infection. It is especially important for those most at risk to get the vaccination. Without getting the vaccine, these people with pre-existing conditions usually have the worst symptoms of the coronavirus. People that are most at risk include the elderly, immunocompromised, obese, diabetic patients, and those with high blood pressure. Just to show you how effective and how dangerous the coronavirus can be, it is important that we show you a few did you know facts. Did you know studies have shown that African Americans have the highest rates of high blood pressure of any ethnicity? And did you know the Latin community are about twice as likely to suffer from diabetes and chronic liver disease than the Caucasian or non-Hispanic community? With these facts in mind, due to these health disparities, these individuals are more prone to having the worst effects from COVID-19. Below, in the left-hand corner, we have an age-adjusted rate graph showing you the cases, hospitalizations, and potential deaths of the coronavirus and its effects. Blue represents white, orange represents the African American community, and green represents the Latinx community. You can see, just by looking at the staggering numbers of African American cases, that the coronavirus is something to take into serious consideration. They by far have the most numerous numbers of cases and have the highest levels of hospitalizations and deaths within our community. Following closely second by the Latin community. They have the second highest number of cases of the coronavirus, the second highest hospitalization.
Hello, this is Elwyn Clark, and as we've just heard from Allison, the African American and Latinx communities have bore the brunt of the COVID-19 pandemic. This virus has devastated the African American and Latinx communities, which is why we've come together with LifeSpring Community Health to try and increase uptake of our best defense against COVID-19, which is vaccination. However, we recognize that there is no shortage of reasons for these communities to be skeptical of our healthcare system in general and to feel that hesitancy with regards to being vaccinated. In order to relieve that hesitancy, we are working with LifeSpring Community Health to spread the word in the African American and Latinx communities about the COVID-19 vaccine, in the hopes of fostering trust within these communities by dispelling myths about the vaccine, advocating for the individual, and ultimately promoting healthy communities. We know that there are many factors that play into an individual's decision regarding vaccination. These factors can include one's own feelings about the vaccine, as well as the overall community sentiment towards vaccination in general. These two factors play a large part in influencing an individual's decision regarding vaccination, but other factors as well, such as availability, accessibility, and affordability, are also key players. This is often referred to as the ecological or social ecological drivers of behavior, and as you can see visualized above, all of these factors are in constant interplay influencing people's behavior. Through our partnership with LifeSpring Community Health, it is our intention to send a message aimed at influencing multiple factors at the same time. It is our hope that through LifeSpring's strong connection to the African American and Latinx communities, our message will not only be heard, but truly be considered in someone's ultimate decision whether or not to be vaccinated. The context of our message is framed around the idea of risk communication, or risk reduction communication, the elements of which are centered on communicating the hazard, which is COVID-19 infection, demonstrating the risk through the possibility and probability of exposure, and what can be done to mitigate or reduce the risk or chances of becoming seriously ill due to a COVID-19 infection. We want to send our message in an open format that can allow for exchange of information, build credibility, and ultimately promote involvement. Our key goal through partnership with LifeSpring Community Health is to address rumor and misinformation regarding the COVID-19 vaccine, countering these myths with facts in a direct fashion by providing information in plain and understandable language addressing concerns regarding the vaccine. Ultimately, we want to reinforce that the vaccine is safe, that it will not give you the COVID-19 infection, and that in most cases, side effects are mild, that it does not contain any harmful preservatives or microchips, it does not cause infertility in women, alter your DNA, and was not developed using fetal tissue. We want to strengthen the message that the vaccination is 95% effective in providing protection from infection, that they have been thoroughly tested and have been authorized for use by the FDA. And finally, that because of the tremendous federal funding of the vaccine research, anyone who wants to be vaccinated will receive it free of charge.